This plant is where one of the oldest drugs in cardiology comes from, and it's still all over your exam. It's digoxin, a cardiac glycoside used for heart failure and certain arrhythmias. But the reason it's so testable is what it does at the cellular level. Let's zoom into a single heart muscle cell and watch it happen. Digoxin's direct target is the sodium-potassium ATPase pump on the cell membrane. It blocks that pump. Normally the pump kicks sodium out, now it can't, so sodium starts piling up inside the cell. That buildup is the first domino in the whole mechanism. All that extra sodium changes the balance on another protein, the sodium-calcium exchanger. It reverses, sodium goes back out, but calcium now comes in. That incoming calcium triggers the sarcoplasmic reticulum to dump out even more of its own stored calcium. Now the cell is flooded with calcium, and calcium is what actually drives contraction. That calcium binds directly onto the contractile filaments, actin and myosin. With more calcium available, more cross bridges form between them. The result, the heart muscle cell contracts more forcefully. That's the positive inotropic effect digoxin is known for. But contractility isn't the only thing digoxin affects. There's a second pathway working alongside it. Digoxin also acts indirectly through the vagus nerve. It increases vagal tone, which slows conduction through the AV node. That drops the heart rate, which is exactly why digoxin is also used to control rate in atrial fibrillation. But this same powerful mechanism has a dark side. Digoxin has a notoriously narrow therapeutic index. Early toxicity often starts as nausea and loss of appetite. On the ECG, you'll see ST depression, T-wave inversion, and a prolonged PR interval. As toxicity progresses, patients can develop visual disturbances, classically yellow-green halos. And in severe toxicity, almost any arrhythmia can appear, especially ventricular ectopy or bradyarrhythmias. The antidote is digoxin immune Fab, antibody fragments that bind and neutralize the drug directly. And here's the line examiners love to test. Digoxin improves symptoms, but it does not improve survival. ACE inhibitors, ARBs, beta blockers, and spironolactone are the ones with a proven mortality benefit. Same old drug, same old trap. Know the mechanism, and the exam question writes itself.